Hello, my name is Nicola.
My name is Mohammed.
And we are sleep physiologists based at Wythenshawe Hospital. Previously, you had a sleep study, and this confirmed a diagnosis of obstructive sleep apnea, also known as OSA. The treatment for OSA is a sleep therapy device known as a CPAP machine. The CPAP machine blows air into your airways, and you wear a mask while you are asleep.
It may take some time for you to get comfortable using your CPAP machine, but this is totally normal. During the first few nights, you'll find that you're waking up more times than normal, but this is because your body is getting used to using the machine. In this video, we will talk you through the components of the CPAP machine, how to set up and utilize the CPAP machine, how to maintain the equipment, and also the follow-up process.
You have received your ResMed AirSense 10 CPAP machine in this travel bag. Unzip and open the bag. As you can see, there are different sections for the various components of your CPAP machine. There is the ResMed CPAP machine. Next to it, a humidifier chamber. If you unzip the back section, you will find the tubing. At the front, there is the power supply unit, your CPAP mask, and spare filters. Finally, in the pockets at the top, there are additional leaflets and information about your CPAP machine. Your CPAP machine should be placed on a level surface at your bedside, such as on a bedside cabinet. For your CPAP to work, it needs to be connected to mains electricity. Remove the power supply unit from the two plastic bags. Plug the power supply unit into the back of the inlet on the back of the CPAP machine. Then connect the power cord with the power supply unit like so. And finally, plug into a wall socket. Next, you will attach the tube. Remove the tubing from the packaging. Connect the right angled elbow into the air outlet on the back of the CPAP machine. Then connect one end of the tube onto the elbow. Both ends of the tube are identical, so it does not matter which end attaches onto the elbow. The CPAP machines have an internal humidifier, and we do recommend you utilise this feature. A side effect of the CPAP machine is dry mouth and also bloating. Using the humidifier can reduce these symptoms. Firstly, you need to remove the end plate from the CPAP machine. There is a small catch on the right-hand side of the CPAP. Using your finger and thumb, press this catch down and slide the end plate out. Inside, you can see the internal humidifier heat plate. Remove the humidifier chamber from the packaging. On the side of the humidifier chamber, there is a catch. Lift this and open the lid. This chamber needs to be filled with normal tap water up to the max line on the side. Close the lid gently and slide the humidifier chamber inside the CPAP machine until it is flush. To remove the chamber, using your finger and thumb, press down the grey catch on top of the humidifier chamber and slide it out the machine. You now need to connect the mask. Remove the mask from the clear plastic bag. Unclip the additional plastic strip from the frame of the mask and remove the mask connector. Press the connector into the mask until you hear a click. Finally, connect the mask connector onto the tube. There are a number of different masks available, but most consist of 5 main components: a mask cushion, headgear, a frame, a mask connector, and safety exhaust valves. As you are new to the CPAP machine, it is easy to fit your mask in a mirror or with the help of a relative or friend. Remove the 2 magnetic clips attached to the frame. Place the mask cushion on the bridge of the nose and below the bottom lip but above the chin. Bring the headgear over the back of your head. And attach the magnetic clips to the frame on each side. To tighten the mask, use the Velcro strips on each side to ensure the mask is fitted firmly to the face. Finally, you need to attach one end of the tube onto the mask and the other end of the tube to the CPAP machine. To remove your mask, remove the magnetic clips attached to the frame at the front. Grab the headgear at the back and pull forwards to slide the mask off your face. Once the CPAP is connected to the mains electricity, the following screen will appear. There are 3 buttons on the CPAP machine: the on-off button, the home button, and the silver dial. Before you start your treatment, connect your mask to the tube and the tube to the back of the CPAP machine. To start the CPAP blowing and initialise treatment, press the on-off button on the top of the CPAP. Once pressed, the CPAP will increase its pressures to 4 centimetres of water, as seen here in the green circle. After about 15 seconds or so, the screen will go dark. This is to ensure that a bright light in your room does not keep you awake. 4 centimetres of water is the lowest pressure the machine can blow at, and it will remain at this pressure until you have fallen asleep. Once you have fallen asleep, the pressure will automatically adjust during the night to keep your airways open. To stop the air blowing, press the on-off button again. A sleep report screen will appear, giving a brief overview of the sleep data from the night before. Firstly, we have the usage hours, how long the CPAP was blowing for the previous night. Next is the mask seal. Green face indicates a good mask fit, whereas a red face indicates a poor mask fit. And finally, the humidifier. Again, green face indicates the humidifier was functioning as expected. A red face suggests a fault. The sleep data is stored on an SD card located on the left-hand side of the CPAP machine. Please keep the SD card inserted into the CPAP. To return to the home screen, press the home button. By using the silver dial on the right, turn this to highlight 2 different options. By clicking in and selecting sleep report, this will direct you to the sleep data from the previous night. Press the home button to get back to the home screen. By selecting My Options, there are settings that you can alter to help you become more comfortable with the CPAP machine. Changing these settings will not alter the pressures of the CPAP. This can only be done by a member of the sleep service. Firstly, scroll down to humidity using the silver dial and push the silver dial in. You can alter the humidity settings depending on if you are suffering with a dry mouth. If you do suffer with dryness, then turn the humidity up by selecting a higher number with the silver dial. If you experience water in the tube, also known as rainout, then reduce the humidity settings and select a lower number. To confirm your humidity choice, push the silver dial to store your settings. The final setting available here is the Run Mask Fit setting. This is designed to help you assess and identify possible air leaks around your mask before you go to sleep. To use this, put your mask on, select Run Mask Fit by pressing the large silver dial. The CPAP will start blowing air at a much higher pressure. On the screen, the green face indicates a good mask fit, whereas a red face would indicate a poor mask fit. This can be quite frightening to start with, but if the mask is fitting well, little noise will occur. Alter the headgear and position of the mask to keep leak to a minimal. To stop the mask fit, press the silver dial in. Once you have completed the mask fit setting, to start treatment for the night, please then use the on-off button on top of the CPAP machine. Cleaning of the CPAP consumables should become part of your normal routine. It is easier to clean the consumables in the morning as it leaves all day for them to air dry. Let's start with the mask. Disconnect the mask connector, and the mask cushion disconnects from the frame like so. The mask cushion should be cleaned daily, and the headgear and frame should be cleaned weekly, both with green washing up liquid mixed with warm water. The tube should be cleaned weekly. Pour a jug of washing up liquid mixed with warm water into one end of the tube. Swish the tube around, then rinse out with fresh water. Hang the tube over a shower curtain to dry and avoid drying in direct sunlight. When using the humidifier chamber, lift the catch, empty the contents of the chamber every morning, and remove the seal and leave to air dry. Every night before use, replace the seal, then fill to the max line with fresh tap water before use. The humidifier chamber should be cleaned weekly, again with washing up liquid mixed with warm water. The chamber is able to be washed in a dishwasher provided the drying temperature is not too high. The filter needs to be changed every 3 to 6 months. The filter is located on the left-hand side of the CPAP behind the vented filter cover. Flick the filter cover down, remove the current filter, dispose and replace with a fresh filter. Lift the catch back up to finish. Finally, once a week, wipe down the outside of the CPAP with a damp cloth to remove any excess dust. The consumables will last 12 months if they are cleaned routinely as per the previous guidance. As a sleep service, we can provide new consumables every 12 months. As a sleep service, we believe routine appointments are crucial in enabling our patients to get the maximum benefits from the CPAP machine. To do this, the data from your CPAP machine is sent automatically to the sleep service so we can monitor it using a system called remote monitoring. You can also access your data via the myAir website. Please see the leaflet located in your CPAP travel bag. If you require any additional information, please see the other leaflets in your CPAP travel bag, particularly the Quickfire Start Guide and the Obstructive Sleep Apnea and CPAP Patient Guide created by the Sleep Service at Wythenshawe Hospital. Alternatively, you can contact the Sleep Department at sleep.service@mft.nhs.uk or call the CPAP Technical Support Helpline on 0161 291 5335.
Good luck with your CPAP machine. Initially, the CPAP may be daunting for some people, and the first few nights might be difficult to get to sleep, but please persevere, and with time you may feel the maximum benefits and start feeling positive about the treatment and feel the maximum symptom benefit as well.
To achieve the maximum benefit, do try and use your CPAP machine for a minimum of 4 hours a night. Remember, perseverance is key, and good luck. Thank you.